Hi guys, you're welcome to my channel. It's the World AIDS Day and the theme for this year is equalize. Basically, various inequalities exist in the world globally, among nations, countries, families, communities, and the world has recognized the fact that inequalities thwart the efforts towards the epidemic control of HIV/AIDS. And so the world has come together to equalize because it is important that equality is established in order for epidemic control to happen. Today on my channel, I'm dedicating the space to talk about the frequently asked questions. So I'm going to be talking about I picked 6 questions and I just want to use this video to address them. And these questions are related to HIV. I've actually been getting these questions, but I've just been saving them up for a day that I would want to delve into issues concerning HIV and how they affect mental health. Hi guys, my name is Paula Ekene. I give you tips on how to stay on top of your mental health game, and this is Paula's Health Tricks. To the business of the day, guys, let's go. Before now, this was not possible. I mean, you had to go through the rapid diagnostic kits that involved a needle prick, of course, and then the blood spot, and then read the 2 lines or 1 line as the case may be. But these days, there is an oral kit that you can use to test yourself for HIV. It is not actually diagnostic, it's a screening kit. But then if that kit indicates that there's a need for another layer of tests, then you proceed. So good news, guys, there is actually a way that you can test for HIV without being pricked. Of course, that's the first one. And then if there is a need for you to get pricked, you'll be told and your consent to be fully obtained. Remember that even before you use the oral kits, your consent must be obtained. So the oral test kit actually works like this. It's in a par, you untie it, and then you bring out the one that looks like a palette or something that you can use to take samples of your saliva. You take it to the corners of your mouth. You put it in a place. You also see an indicator that shows where you can put your saliva, and then in a few minutes you read the results. So please get tested. There are oral kits available that can use your saliva. You don't have to necessarily get pricked. If you're negative, you don't have to proceed to do other tests. If you need the saliva test kit, please let me know. You can just send a message to Paula's Health Tricks at gmail.com, and I will let you know where you can get this kit in a place that is very near to you, in such a manner that you wouldn't have to spend so much or travel to another state. I'll let you know the places that you can obtain the oral test kits. Yes, are the oral test kits free? It depends. I mean, in some locations they are free. There are some brands that some funders have subsidized greatly. I think you can get some at 1,000 plus. There are some that are free, while some others you can get them depending on if someone has paid for the one that you come across. You can get it free. Some people just get to pay so that other people can actually access these kits. So yes, this happens almost every day. Yes, people who do not have the virus are getting married to people who have the virus, and because HIV is no longer a death sentence, it is no longer a big deal. What matters is that the person who has the virus is willing to be suppressed. Suppression means that the amount of virus in their blood is so low that it is almost not detected by the tests that get to detect the number of virus in 1 ml of blood. If you have the virus in your blood and it is less than 20 copies per ml, you know what that means? It means you cannot transmit the virus. You can't actually transfer the virus. That's why you have some couples, people who have their partners who are negative and they are positive. And you know, from time to time, the partners get tested, and you see people living for up to a decade or 2 decades with someone who is, you know, with the virus, and they do not come down with the virus because their partners are suppressed. and they are all living happily, healthily, and sticking to their medications. All you need is to be on lifelong medications and you're good to go. And then we also encourage the use of condoms, and there's something we call pre-exposure prophylaxis. It's like the oral pre-exposure prophylaxis is the one we take by mouth. There are also injectables, but in this part of the world, we are actually using the oral PrEP. And what PrEP does is that if you think that you were exposed constantly or you engage in risky behavior that might predispose you to acquiring HIV infection, you take PrEP. So you take PrEP for as long as you think that you are exposed to the virus. Okay, this is assumed to be common knowledge, but I'm going to say it nonetheless. So you can prevent HIV infection by ensuring that you take precautionary measures. By knowing, you have to know first. So knowledge is important. You know how you can acquire it. And how can you acquire HIV? HIV can be transmitted from a mother who has the virus to her child, her unborn child. And so when the child is born, if the right precautions are not taken while the child was in the womb, and when the child is out, there are different things we do for these people to ensure that they do not come down with the virus. So if these things are not done, the chances that this child will come down with the virus are up to 60 to 80%. And the second way you can get it is through sharp objects, using sharp objects that can have blood or fluid or body fluid, the blood of an infected person. If they have contact with your own fluids, then you are at risk of acquiring HIV. So this can be through razor blades, needle pricks, blood splash, or basically blood and body fluids. So that's why if you have getting a blood transfusion and the blood of someone who has the virus is transfused into you, then you are going to come down with the virus. And that's why laboratories and blood banks screen blood that they give out extensively to be sure that they are not giving out blood with HIV. So the other way you can get it is through sexual intercourse, consented and non-consented. Consented in terms of having sex with a partner who has HIV and without condoms. Of course, condoms are not 100% safe, but then they help a great deal. And it's good to ensure that the condom does not tear in the process. But in the process of intercourse, if the condom tears, then you have to get up, replace the condom. So for non-consented sex, there's something called post-exposure prophylaxis that you get to give to people who are raped to avoid HIV infection. So when rape is established and you visit the clinic or any health care service unit, you are provided with post-exposure prophylaxis within 72 hours of the incident. This is because after 72 hours, the chances that post-exposure prophylaxis would work would be lowered a great deal, so it might not work. You can share spoons, forks, you can share plates, you can share toilets, you can hug, you can, you don't have to discriminate or stigmatize against people living with HIV. I guess that with all this information, it is clear that there is no basis for stigmatization or discrimination against people living with HIV. So you can protect yourself by abstaining, being faithful to one partner, or ensuring that you do not expose yourself to blood and body fluids of people who you do not know their status. And knowing status is relative. You can know one status in the last 6 months, but you might not know their status today. So at every point in time, you don't carry test kits around to check for people's status, and so it's important for you to know that if you have just one, if you have more than one partner, then you should protect yourself while having sex with them. Very possible. There's something we call PMTCT, prevention from mother to child transmission of HIV. There are, different services available, and these services include ensuring that women who are of reproductive age, and of course everyone knows their HIV status. It also includes ensuring that people who are positive and of childbearing age do not have unwanted pregnancies, because the more the unwanted pregnancies, then the likelihood that one of these children that result from unwanted pregnancies would come down with the virus if the various precautions are not taken. Also, we ensure that people who eventually get pregnant and who are living with the virus are taken care of in a way that they will stand very low chances or no chance of transmitting the virus to the unborn child. This is done by ensuring that they are suppressed and on medications, and especially close to the time of delivery. And another aspect of the service is also to ensure that when people pass down the virus to their children, it's taken care of so that they can live long. So when a child is born to an HIV negative mother, within 72 hours, there's something called HIV exposed infant prophylaxis. Those are medications given to a child born to an HIV positive mother to, prevent the virus from taking over the child's system. And so the child is taken care of within these 72 hours and also reviewed from time to time. Women who are living with HIV can give birth and breastfeed their babies exclusively for up to 6 months, and start complementary feeding in addition to breastfeeding. And of course, the healthcare worker will tell you when to stop breastfeeding. Review your child and yourself from time to time. There are different diagnostic tests that from 0 to 3 days to 6 months to 18 months, where your baby's samples are taken to ensure that the child comes out negative, and at any point the result is relayed to you and you are in tune with what is happening. You are encouraged to continue to take your medications, and that way you stand less chance of transmitting the virus. And if at all your child comes down with the virus, there are services available like adolescent and youth-friendly centers, child-friendly centers that can help your child live a positive life. There's also age-appropriate disclosure, at what point you get to tell your child their status and let them know what the pills they are taking is for, to help them to be positive and support their treatment. Yes and no. You can know if it's recent or if it's a long-term infection. You cannot know how. You can think around the different scenarios that played out. You might not know how if there are no specific scenarios such as rape or maybe particular sexual intercourse or transfusion that I can link it to, but you never can tell how. And that's why we really don't emphasize on how, because as much as possible we try to not be judgmental about how a person gets HIV. It can be gotten by people from no fault of theirs. You can know if it's a long-term infection. It's called a recency testing, where you get to know if the virus has been in your blood for up to 3 to 6 months, or if it has been there for years. But it will not tell you specifically for how long it's been. It will only tell you if it's a recent infection or if it's a long-term infection. Now, policy makers, decision makers, and healthcare workers, and of course government of countries use this recency testing to know far and the extent of epidemic control, because if you keep having recent infections all the time, it means that holes need to be plugged. Is a call to action actually. Wow, this is another question that I am happy to hear because I've treated it sometime, and I'll just go ahead and link it up here. I discussed how HIV affects mental health and how you can support, and how people living with HIV can get mental health support. So I'll just link it up here and I'll let you watch it feel free to watch it and understand how you can improve the mental health of someone living with HIV. Remember, stigmatizing and discriminating against people living with HIV will do no one any good. It is important that you equip yourself with the right knowledge. You can also always send a mail to paulashealthtricks@gmail.com and ask your questions. I'll probably treat more in subsequent videos, but for now, stay safe, keep living, keep being positive, and keep taking care of your mental health. Remember to subscribe to my channel and press the bell button so that you don't miss out on new videos. Until next time, guys, see you in my next video. Bye bye.